But anyway, I'm glad that you're here this evening in person too, as well as on Zoom, joining us with Dr. Amy Rothenberg. We're so grateful that she's here to share her knowledge with us. It is really such a gift. Thank you.
You're welcome.
And just to tell you a little bit about Dr. Amy Rothenberg, she's been practicing as a licensed naturopath for over 40 years right here in Northampton. She has a private practice with her husband, the Naturopathic Health Care on Pleasant Street with her husband, Paul Hirschkew. And so as a naturopathic doctor, Amy has devoted her whole career to helping others in holistic ways. And in 2014, she was diagnosed with breast cancer. And, not only did her training help her recover, but she went on to write a book for cancer survivors about how to rebound and reduce the risk of recurrence. We have that book here tonight in case anybody wants to get it. It's right outside the door. It is just filled with a lot of very, very helpful information. I know it's been very helpful to me as a cancer survivor too. So since then, she's consistently been working to share her knowledge with people, both through her practice, through her books, and through her speeches and talks that she gives, and helping to share those tools with everybody. And again, we're just very, very happy that you're here tonight.
Okay, thank you. Okay, all right. Well, thanks for coming out on this cold November night. It feels like we're really getting into winter here. And hi to everybody who's tuned in online. I'm sorry I can't see you. Feels very unfair, but that's how we're set up, so that's okay. Hopefully I'll get to meet you in person somewhere, sometime. For me, as a breast cancer survivor, that year that I had breast cancer in 2014, I also had ovarian cancer. A few months later, after I was done with my breast cancer treatment, I was diagnosed with ovarian cancer. How's that for a year? Yes, I found a lump in my breast January 1st, a couple months after a normal mammogram. I had tested negative for the BRCA mutation in my 40s, and then I had retested negative in my 50s. And I only tested a second time because I knew that the test was getting better, and I tested negative. So they told me I needed, lumpectomy and a little radiation. I was like, no way, take them both. Because our family, we might not have that gene, but we clearly have something. My sister had breast cancer. My mom had died quite young from it. And so I chose to be very aggressive with my treatments. And they said, well, actually, you really need to get tested for the BRCA mutation. I was like, I just tested last year. The test has gotten better. I tested positive. So it's a good thing I had both breasts removed because I would have had to do that, a few months later. And then I finished my treatment. I had 4 rounds of chemo. I had 28 radiation shots to my chest wall because there was a little bit of lymphovascular invasion, as if the tumor that was there was trying to set up shop somewhere. So I just I'm going this far, just do the radiation too. And I finished that, maybe in July. And they said to me, why don't you wait a year and then we'll remove your ovaries. I was 54 at the time. And I was like, no way. This year has been like crap. I'm not bringing this into the next year. As soon as my hemoglobin hits a 12, let's go for my ovaries. Because my blood counts kind of went down with the chemo. And they went to do the prophylactic hysterectomy. And I was going to remove my uterus as well because I was a candidate for tamoxifen. I had estrogen receptor positive cancer, and I was premenopausal at the time of diagnosis. I was going to go on tamoxifen, which puts you at a little bit of risk for uterine cancer. So I was going to have a complete hysterectomy, which I had laparoscopically, just 2 little dots out through the vagina. Mind you, I had 3 home births. The apparatus had really worked well for us, in our family. So I was okay, whatever. About the time of menopause is not such a tragedy. Take it all. And they found cancer on both ovaries. I was like, what? A little bit hard to believe. And many times, in those of you who've been through cancer, or somebody you love has been through cancer, there's a whole national cancer guidelines in terms of cancer and what the treatments are that are most typical standard of care for whatever a person might have. And so a couple years before, somebody with the same diagnosis, I had stage 1 ovarian cancer, which is kind of unheard of. Negative nodes, clean margins, clean abdominal wash. A few years prior, the treatment would have been complete hysterectomy done. but the guidelines had changed, and it became more like take no prisoners, and in case there's anything, how about 12 more rounds of chemo? So that entire year, I had my first, I found the lump January 1st. My last chemo for the ovarian cancer was January 2nd the following year. So at my last chemo, I said to my husband, okay, in 6 months, we're going to do our first triathlon. And he looked at me and he was like, yeah, maybe you are. I'll be on your photography team, But I did that, and I'm a very athletic person anyway. We're going to talk a lot about that role of exercise in for cancer survivorship, which is a very important thing. I really did make a very, very good recovery. I was very lucky. I went in very healthy. I went in kind of on the young side, very healthy. And I did everything that's in that book I basically have done. And I also didn't have a lot of the big side effects that many people have, probably because as a naturopathic doctor, I was doing a lot of things during treatment that A, enhance efficacy of treatment, B, reduce the chance of some of the side effects, and 3, address some of those side effects that I did get early on with natural medicine, with some conventional medicine as well. I'm not against conventional medicine. I'm alive because of conventional medicine. I waited about 10 years to write that book. I didn't want to seem cavalier. The book is called You Finished Treatment Now, What a Field Guide for Cancer Survivors. It is an Amazon bestseller. It won a Nautilus Book Award. It's doing very well. I read it for Audible. If anybody needs a signed copy, just let me know. But anyway, I waited 10 years because I didn't want to seem cavalier. And I didn't want to jinx anything. I just didn't want to jinx anything. 8 months, and I had a fabulous agent and a wonderful publisher. I didn't want to self-publish. I have a traditional publishing contract. 8 months after that book was published, I was diagnosed with ALL leukemia. And that is not so really related to the BRCA mutation, but it's considered secondary leukemia from all the chemotherapy that I had for the breast and ovarian, put me at risk for a blood cancer. So I did everything you need to do to get rid of leukemia, which is more chemotherapy for a few months, some immunotherapy to lock it in, and then I was a blessed recipient of a perfect match stem cell transplant 2 years ago, January. In May this year, I met my stem cell donor, the amazing Maya, 23 well, she's 25 now, but she's 23 years old. I met her in Israel. Phenomenal person, and I feel like I have another daughter, which of course is really more the opposite, but yeah, it's just a beautiful, sweet relationship. So for me, the concept of survivorship and the concept of, how much does one define themselves by the cancer that they've been through or other illnesses, it's very individual, and so the no judgment zone. I personally don't think of myself so much as a survivor. I think of myself more as like a thriver. I feel like the survivor just has this connotation of like surviving, and there are moments like that, I'm sure, for all of us. But what I'd like to talk about tonight really are the things that are evidence-based that really can address the main kinds of problems that people tend to have after going through cancer treatment. For a lot of people, the cancer that they had never really made them sick. Some people it did. They were very symptomatic. They felt like crap. They were bleeding. They found that, but a lot of people, it was picked up on a test, picked up on a lab work, picked up on a mammogram, picked up on a uterine ultrasound for something else, or, what have you. And so for many of us, we never felt sick from the cancer. It's just the treatments that make us sick. And that's by design. They're very, very strong. They're very, very powerful. They have a big job to do. And those treatments can make us sick. And for a lot of people, when we have symptoms that persist after cancer care, some of it's from the cancer itself, where the cancer was, what it was impinging upon, how it affected the heart, the lungs, the digestive organs, the brain, etc. And most of us, if we don't have that, or we have that and we have the longer lasting effects from whatever the treatments were that we have. And some of these treatments have very, very long arms. They have the effect that they have at the moment, and then they continue to do damage down the road. That's especially true with radiation. So these are things we have to talk about. And then some things feel like to me just about dumb luck. Like for instance, somebody has breast cancer. Like, if you're gonna go out there and get yourself some breast cancer, try to get it on the right side, The left side, if you're going to need radiation, the heart is there, and you only have one of those. Your lungs, you got two of them, and you can go from the top to the bottom. So, these are things that we're not controlling. I'm sort of saying like a joke, but truth of it is, sometimes people, like for me, like with leukemia, I'm so glad I had ALL, not AML, because that's harder to treat. It's just that's the luck of the draw. The main problems that I see in my practice that people complain of who are survivors and thrivers, fatigue, brain fog, lymphedema, peripheral neuropathy, lack of satisfaction or interest in sex and intimacy, all that down low kind of stuff, and heart and mind stuff too. Body aches and pains, kind of in general, problems with the GI, anxiety and depression, insomnia, and susceptibility to getting sick. And many people have all of those, literally every one of them. Some people have, A, B, D, E, and F, like a combination thereof. And what you'll hear as we go on through tonight is that many of the recommendations that I'm going to make, it's kind of like rising tides raise all ships. And so some things that are good for one thing, they're also good for other things. Anti-inflammatory diet, exercise, stress management, like that's going to help everything to one degree or another. And then there are more specific things as we go along. So I hope that's what you signed up for, because that's what I'm planning on talking about. If not, feel free to leave, where you've got probably better things to do. The one thing I will like to say, because many of us who are survivors, we are in the community and we have family and friends, we're going to know other people that are going to go through cancer. Everybody is, because it's now Surgeon General is about to come out with, it's going to be 1 in 2 people in America is going to have some form of cancer in their lifetime. That's half of people. And, everybody knows somebody. So what I would say is that there are a lot of kinds of complaints that survivors have that were preventable during treatment. So it's a little late for some of us because we've already been through it. But for instance, peripheral neuropathy. We know now that like the cold booties and the cold gloves really work. They make it so that you vasoconstrict during chemo, and the chemotherapy can't get all the way to the end there. And we're not too worried about metastases to the fingers and the toes. So by driving the circulation away, the chemo doesn't get there. So like that's something that should be at least offered to every patient. And it's not. And part of that's because it's expensive, and the gloves and the booties are expensive if you buy the ones that have been FDA approved, or it's unpleasant. It's unpleasant enough to go to the hospital and have chemo. It's doubly unpleasant to sit there with cold on your hands and feet. It's not that fun. B vitamins and fish oil are also known to really help prevent peripheral neuropathy, and they really should be prescribed for everybody going through it, unless it's strongly contraindicated for another reason, and there are some reasons. But conversations like that, where we can maybe prevent some of these side effects from beginning, like a big study came out last year around using the sleeve prophylactically for all women that have breast surgery. Now, all women do not develop, and men get breast cancer too, and also get lymphedema, but all people that go through something like that do not develop lymphedema. They don't. But if you were advised for 1 month, wear the sleeve 6 or 8 hours a day just to prevent it. Like it's not that hard to do. So I'm very much interested in the idea of prevention, because it's easier than treatment. I mean, it's just easier than treatment. Okay, so fatigue. Let's start with fatigue. First of all, a lot of people were tired before they ever had cancer. So you can't blame everything on cancer. For a lot of people, it's the cancer or it's the treatment. But I just want to throw that in there. One of the definitions of the fatigue that I really relate to as a doctor is that sleep and rest does not help. So for like the typical person who's tired, if they sleep or they take a nap or they rest, they feel better. A lot of times cancer-related fatigue and chemo-related fatigue, it doesn't matter how much you rest. You just have that kind of, can't get out of bed. And the fatigue kind of goes along with depression. People that are depressed tend to be, low energy, not that excited about life. A little bit like things they used to like don't really excite them anymore. Like there's a shift. So there's that. And then for me, if a person doesn't have enough energy, then like all the millions of other things I'm going to invite them to think about and try, you have to have energy. You have to have something to start the fire, And so I'm often starting at the concept of like, what can we do to help the energy? And during treatment, it's, of course, people are tired for many reasons. These are toxic treatments because they need to be toxic to do the job they need to do. And some of them have the side effect of fatigue. And then also people's blood counts tend to go down, particularly with chemotherapy. And radiation is also, it's a poison to our system, a needed one at the time. Because, every drug, every approach, we're always weighing like the benefit versus the risk. And for cancer stuff, a lot of it's like there's a lot of risks, but we're going for the benefits. So for people being tired during treatment, I'm not worried about that. That's normal. And we do know that during treatment, exercise does help reduce the intensity of the fatigue. And it doesn't have to be a lot. It could just be gentle walking, getting on the floor and stretching, doing something a little bit, a little bit of TheraBand workout, any of that and I have to kind of really be a cheerleader with my patients in treatment. It's like, I know it's the last thing you want to do. And please, if you need to take a day off here or there, or, with chemo, a lot of people, it's like every third week they're getting it, and they have 10 good days before the next subsequent, infusion. During those 10 days, those are days, get out, get on your bike if you can, get in the pool if you're allowed, whatever you might like. So underlying comorbidities are also important when we talk about fatigue. So for people that have type 2 diabetes, for people that have thyroid disease, for people that have depression, like clinical depression, like these are unrelated to the cancer, and they're, in the most direct sense, and unrelated to the treatment. So we have to also address underlying things that might be causing fatigue. Unrelenting stress. Of course, any cancer diagnosis itself offers unrelenting stress, but people also have their lives. Their kids are stressful, their parents, housing, the job, that don't even get me started on the news cycle. Unrelenting stress makes people tired. So, we either need to. With my patients, I like to have conversations. What are the biggest stressors? Give me your top 5 stressors, or give me your top 3 stressors. And are there any ways we can help mitigate them? And relationship stress is probably the biggest one out there, and it's not a great time to change up relationships in the middle of treatment or right after treatment. It's sort of like you kind of need your person, or if you have one, and but that is a big contributor to people's stress. So if people can't necessarily mitigate the stresses that they have, then what are they doing on a consistent basis that helps them to raise their threshold for feeling stress, dissipate the stress that they have, manage their stress management? And we're going to talk about all the different tools that I love. And I think nutritional status can also contribute to fatigue. Sometimes people are eating the wrong diet for them, or they're eating foods that they're sensitive to, and that's going to make them tired. Alcohol, there's really no safe amount of alcohol, unfortunately. That will make people tired. And there's a lot of ways that fatigue manifests. The shortness of breath, there's like what I talked about already, too tired, can't get out of bed, can't do stuff you like. Loss of muscle mass, sarcopenia, and then also literally difficulty thinking, which kind of goes over to brain fog, which we'll talk about in a minute. But that just not feeling like you have your wherewithal to, put yourself out there in the world. You always have to rule out anemia. If people are anemic, a lot of times in cancer patients, it's not about getting enough iron. You look at their iron stores, there's plenty of iron stores. They've had enough from years of eating enough iron. They're just not getting from the iron stores into the bloodstream. So there are ways to help facilitate that. And we just are looking at that. Okay. Inflammation, chemotherapy is very inflaming, as is radiation. So inflammation will also make people tired. So a lot of times people will say to me, oh my God, I feel, they're 50 or 60 and I feel like I'm 80 years old, I can't get out of bed, I'm so sore. Like that kind of inflammation makes people tired. And being tired makes people feel more like that because they're not doing the things they might do to help unwind some of it. So we'll talk about that in a minute. The conventional treatments for fatigue, corticosteroids are used, all the dexamethasone and things like that. But the problem with dexamethasone, it gives people that energy, right? Everything that goes up, where it's heading. It's got to have to come down. And a lot of people experience, I don't know if any of you did, the dexamethasone crash. You get a little bit of dexa with your chemo because it helps to prevent allergic reaction. And it actually also helps the chemo work better for a lot of different biochemical reasons. But it's often given without a taper. Like if anybody's ever had steroid treatment for something else, there's usually a taper. But a lot of times with the chemo, you just get a whole bunch, and then you basically get none. And then, so for 2 or 3 days after chemo, I'd come home and I'd be like, oh my God, let's clean out the closets and let's rake the lawn. And my husband was like, oh my God, what are you on? And I knew exactly what I was on. I was on the DEXA. But then I would crash. And by nature, I'm not a depressed person. I just, luck of the draw, I seem to get cancer. I don't get depression. But I would get this crash where I would be like curled up. The way I would describe it is curled up like a little pea inside of a pod under my blanket. I didn't want to get out of bed. I didn't want to eat. I didn't want to talk. Very different for me. And After a few rounds, we realized, oh, this is the DEXA crash. So the first thing I did is I asked my doctor, can I please have a taper? Can I please have it? You can ask for a taper. They may say no, but you certainly can ask for it. And then the second thing is that you can do a few things to support your adrenal glands. So a cup of coffee, a nice piece of dark chocolate, some nice massage and Reiki right to the adrenal area. You can take things like licorice root, which the tea, like licorice root tea, is beautiful for supporting adrenal function. And for a lot of people, the hypothalamus adrenal pituitary axis, this is a whole thing within our physiology, is so fried from having had cancer. Just sitting getting the news, just sitting trying to make the plan, just sitting trying to figure out the rest of your life it's so big that whole system is burnt out. And we call it adrenal burnout. You've probably heard that expression. Those are good things for people in survivorship years or people living with cancer. Remember to try to support and send some love to your adrenals. They're working on your behalf. And we need them. That's the fright and flight. That's the adrenaline when you get excited for the thing. And like if you feel like you never get that anymore because your adrenals are just, they kind of just punked out, you can do things to help support adrenal function like that. The other things that you use for survivors that are experiencing fatigue that doesn't respond to other things are ADD medications that are basically stimulants. And that is something that, if the shoe fits, that might be something to consider. Antidepressants are used. I'm not a huge fan. A lot of people are on them. Maybe a third of adults are on antidepressants or anti-anxiety meds. It's really bad. But for a lot of people, they don't work or they don't work well enough or they shrink their experience of life. And then these were drugs that were never, ever meant to be used in the long term. They were never meant to be used in the long term. They weren't researched or studied in the long term. They were meant to be used in the short term when we need it. Your dog dies or your wife walks out on you. I don't know, whatever it is, like you need it for a few months to get you over whatever. I mean, that wouldn't be my first choice, but I get it. But for years and years and years, and they affect people's bone density, they affect cognitive decline, they affect quality of sleep. So, and all side effects, just going to remind everybody, all side effects of drugs are dose dependent. And for many people, they can slowly wean themselves off of medications with guidance and help and use other things to balance whatever the drugs were doing for them. And there's a growing list of other drugs being used now and considered for cancer survivors with fatigue. For me, the number one treatment for fatigue is exercise. And you have to start slow. It really just is so dependent on what your habit was before. A lot of people had a good exercise habit and have muscle memory and body memory, and they just can pick up the thread and they can't go as far, as long, or as much. For other people, they never had an exercise habit. So I say, well, it's a great time to start. And let's just think about what do you maybe like to try. I mean, what I do with my patients is one-on-one. What can we think about that might be appealing to you? Walking is plenty. Stationary bike can work. Getting in a pool, jumping rope, dancing, Zumba class. I mean, literally the options are endless. In our area here, we have the Live Strong program at the Y, which is excellent. I can't say enough good things about them. And then also like the senior center, anybody who's 55 or older, and you don't have to live in Northampton. The senior center in Northampton, they have a menu of exercise stuff that is very long and, for any body type and any experience with exercise. So for people who already have a good exercise habit, I'm always like, okay, you probably can improve it, like a little bit more, get it into 3 areas of something aerobic, something weight bearing or resistance training. That means either lifting weights or therabands, and then something that's kind of stretchy like yoga, tai chi, qigong, sitting on the ground and just stretching. That's the 3 areas. So exercise, it gives people energy because you're better perfused, meaning that you're moving the blood around better, and so it's getting to your brain and getting to all your muscles. So that's important. The other things that we do for fatigue include supporting the adrenals. Ginseng, the herb ginseng is very powerful. Ashwagandha is probably the single best herb for adrenal support. Ashwagandha, you might have heard of that. Rhodiola is another one that's very good. And you can buy these in combination, like a ashwagandha, rhodiola, ginseng combo in a capsule. You could take a couple of those a couple times a day. It just gives people a little bit of lift. And turmeric, which is sort of the darling of herbs these days, It's derived from curcumin, derived from turmeric. It's like anti-inflammatory, antibacterial, antifungal, antiviral, anti-cancer. It's sort of a beautiful herb. And there's not very many things I would say everybody should take, but that's one of them, unless you're allergic to it or something. That's a very rare allergy. It's a beautiful herb, and it helps to bring energy into the system where the energy is kind of flat. I would say there are other like whole person systems of medicine that I have found very effective in treating fatigue for cancer survivors. So I use homeopathy, constitutional homeopathic remedy. You kind of need to go to somebody to get one of those. Acupuncture, where it's like they're looking at the whole person, all the different pulses, the tongue, that can help get the energy, the healing energy moving through all the meridians. And then supporting, there's a whole thing in the world of naturopathic medicine, which is basically supporting the emunctories. The emunctories are the things in our body that help us detoxify from the natural things that we don't need anymore. So I don't mean detoxing from like the problems with the air, the water, the food supply. I just mean you eat food, you're going to have a bowel movement. You don't need everything you eat. You get rid of some of the stuff you don't need. You're going to urinate. You're going to take deep breaths that helps you get rid of certain things through the lungs. You're going to sweat sometimes, and that's the sweating. All of these ways of getting rid of the circulating toxins in our system has a way of helping us feel less tired. I don't know if you've ever like just sat around for a lot of days in a row and eaten kind of crappy, maybe had a beer, and then like you just feel so bad. Like it's just not how our systems were meant to be taken care of, if you will. So supporting the emunctories and making sure, like for me, a lot of people are constipated. It's so common. And there are wonderful ways of supporting people out of constipation to have regular, satisfying bowel movements. All right. And then, of course, we do have to sleep well. And I think that we're kind of, I don't know what anybody else thinks, but I think we're in a little bit of an epidemic of insomnia. People can't fall asleep. They can't stay asleep. They have to get up to pee 2 or 3 times. The sleeping is not satisfying. They don't feel like they're getting a deep sleep. And so what are the things that we can do to help ensure good sleep? Well, sleep hygiene around, I don't think I need to talk about that. People know what I mean by sleep hygiene, or should I talk about that? Well, like, turning off the cell phone, keeping it in another room, having the room be cool, not having caffeine if you're sensitive to it after a certain hour, trying to exercise earlier in the day seems to have a good effect. Yes, all of these things. And and having like, any of you who were parents, like it helps to have a routine with children. I think grown-ups are kind of the same. So I like my hot bath before I go to sleep pretty much every night. It's like one of my big gifts I give myself. All right. Any questions about fatigue from anybody? Or do you want to look online to see if anybody's typing in, or we want to have all the questions at the end?
Yeah.
Okay, that's fine.
Maybe at the end, and to put them in the Q&A section.
Okay, put your, if you have any questions, those folks tuned in, just put them in the Q&A on your computer. Yes?
Could you just mention again, you meant the ginseng, and then you mentioned 2 other herbs I'd never heard of?
Yes, ashwagandha, ashwagandha. It's Withania somnifera is the Latin name, and rhodiola, rhodiola, rhodiola. Yeah, they're really, really lovely. All right, so brain fog, it's sort of like fatigue. Some people were going in that direction before they ever had cancer. Some people, are just a little bit on the foggier side. But other people really weren't, and now they are. And that is really, cancer causes that, treatments cause that, anxiety, depression, all cause that. And then, all of the other things that are risk factors in terms of heart disease, diabetes, those also contribute to cognitive decline. And then many of the drugs people take also contribute to cognitive decline. All the benzodiazepines that are given out like candy, lorazepam and all those things that end in PAM, they are not great for cognitive decline. So I know a lot of people are on them. Another contributor to cognitive decline is hearing loss for 2 reasons. As people hear less, the brain is less stimulated by the actual process of hearing. And then also people tend to withdraw a little bit in a social setting, and then that's not great for cognition. Okay, so, people complain about not being able to multitask anymore, can't concentrate, memory issues, can't find the right word, not processing, less sharp, just in general. Okay, for people for whom this is severe, where they just feel like, oh, I feel like I'm losing my mind, I will have people temporarily do a ketogenic diet. This is not a long-term diet solution for most people. There are a few kinds of cancers that are relevant to talk about a ketogenic diet. Glioblastoma is one of them. But in general, it's not a sustainable diet. But for short-term use in a person who feels like they're really losing their mind, it can be very helpful. And it's a little, it's clear, the research is very clear, and it's a little unclear why it helps. Ketogenic diet is basically all protein, a lot of fat, no carbohydrates. It's very not sustainable, and it's not a great diet for cancer in general. But for that, it can be helpful. And I would say that the anti-inflammatory diet, which is also helpful for fatigue, is essential, and it's characterized by basically lots of fruits and vegetables, lean proteins, healthy fats, whole grains, full-fat dairy, healthy oils, and not a lot else. So like not a lot of processed foods, not a lot of salt, not a lot of refined sugars. And it's basically, like I said before, rising tides raise all ships. This is the kind of diet that also helps prevent type 2 diabetes, helps prevent heart disease, helps prevent cognitive decline. So, and what I do with my patients is I have them do a 3 or 4 day diet diary, and we go through it, and we look. It's like, okay, you're doing great with this. What you got to add a couple pieces of fruit a day. You just look at what people are actually eating, if they can be honest, and I don't ever underestimate the role of food as a comfort. And so I want people to eat the foods they love, and culturally, what's culturally appropriate. And, I'm not giving people a diet that they can't do. But usually most people can tweak the diet a little bit toward more anti-inflammatory or toward less inflammatory, you could just say. And I think it's effective and it's useful for almost every one of the complaints we talked about. So it's also a diet that has really shown some relevance for preventing recurrence. So then that's like another benefit. The best herbs that we find for cognitive decline are back to the curcumin. You've probably heard of the herb extract resveratrol. That's derived from the skin of red grapes. It's super anti-inflammatory, and it's very good for thinking, resveratrol. And then there's a third one, which is called bacopa, B-A-C-O-P-A, bacopa. Bacopa is known to help people that have memory problems and, just inability to think clearly, addressing hearing loss. And then for me, it's like getting on the phone and talking to whoever prescribed the 7 or 8 drugs a person's on. It's never going to be one person, so all the different doctors people have. Is there any way we can get them on a little less of this and that? Because I think it's contributing to the cognitive decline. In America, people over the age of 60 are on 4 or more medications, every person. That's includes people who don't take any. So on average, So we are an over-medicated, I think, population. All right, lymphedema. Are there any questions about cognitive decline? Oh, and then using your brain. I mean, it's true. Jigsaw puzzles, Wordle, connections, all those things, reading, learning something new. I have found that in my cancer survivors, probably the single best thing to help with brain fog is learning something new. It doesn't matter what it is. I mean, literally. I have somebody in my practice learning how to juggle. Then a lot of people using Duolingo and learning a language, picking up the ukulele, picking up some art thing. First of all, it invigorates the soul, I think, learning something new. And you're just creating new brainwaves. Of course, when you're tired or when you're feeling a little depressed or when you have brain fog, the last thing you want to do is try to learn something new. It's not like the time you want to do it, but if people can get over the hump and just do it, I think it can be very helpful. Yes?
For those herbs that you were saying are so good, what is the best way to take them? Is it like vitamins in a natural food store kind of thing?
Yeah, you can get them at a natural food store. Some of the things you can actually find that they're culinary. So like people can do, I start every time making a stir fry or a soup, I buy turmeric root and ginger root at the co-op, and I have them in the freezer, and then I grate them into almost every dish I make. So I'm always getting curcumin. I probably look a little orange, but I'm always getting curcumin. I like that. But then if I'm working therapeutically with a person, I like to have an amount that I know that they're actually getting every day. And I'll either do like tea bags in some of these herbs. You can do it in tea form. Like there's beautiful turmeric. You can make like golden milk with a turmeric and ginger tea with a little honey and oat milk. Like that's delicious and it's good, you know. But if you're wanting to get like the real bang for the buck, probably capsules is the best way. I think capsules are a little better than the hard pressed pills, which are a little harder to digest. So capsules can work for many of these things.
I have a question.
Yeah.
So you said keto not great diet for cancer. So why not?
First of all, it's very hard to do a ketogenic diet and not get super constipated. So then people are constipated, they're miserable, and you're also circulating all kinds of toxins. It's also, you're not getting any fruits or vegetables, very, very few fruits and vegetables, which we know the polyphenols that make things colorful are very anti-cancer. So ketogenic diet does not include, there's a few vegetables, but not very many, and no fruit. So right there, that's the problem.
So so I don't even know that diet very well, but I used a diet called Whole30, which sounded a lot like what you were describing. There were no grains, no gluten products at all.
Yeah.
So
Whole30 is similar, but and the other problem I would say with the ketogenic diet is that there's very little in the way of prebiotic material. So I have a whole section that I'm going to talk about, which I can just talk about now, which has to do with the microbiome. The microbiome is like everything between your clavicle and your hip bones. That's not like a bone, a joint, an organ, your omentum. It's like the milieu that everything sits in. And the microbiome, the more we study it, the more we understand that it controls so much. It controls cognition, mood, immune function, digestion, everything. And then you have like mini microbiomes everywhere. Like you have a microbiome of your eye, you have a microbiome of your vagina, you have a microbiome in your ears, and they all are derived from the master microbiome. So the organisms, and there are billions of them in each person, like we're made up of multitudes. Each of these organisms, they need food to survive. And what do they need? They need non-soluble fibers. Those are the ones that we don't digest. So like the apple skin and the rindy part of that broccoli spear, you know? And so some of these diets, they don't have any prebiotics in them, period. There's just nothing prebiotic. You're not going to get prebiotics in meat. You're not going to get it in fat, you know? So that's not great for the microbiome, which we're very dependent on because once we have had cancer, we're all dependent on our immune system, but remember that everybody has cancer cells floating around at any given time, and our body has these ways of like Pac-Manning them up. The immune system realizes that's bad and foreign and we don't want it, Pac-Man it up, or we are programmed to do a process which is called apoptosis, which is natural cell death, that is informed largely by the microbiome. So that's why in the long run, those kind of diets are not great for cancer patients. Yeah.
Someone's wondering if someone asked the question.
Repeat it. Okay, yes, I will. Sorry about that. The question there was like, is the Whole30 diet and keto, like why they might not be that great for a cancer survivor? Yeah, that's a great question. All right, so lymphedema, mostly we think about it in the arms, but people can get lymphedema in the legs, any kind of GYN or prostate surgery. They can get lymphedema in the legs. People can get lymphedema anywhere in the throat and chest with head and neck cancers. People can get lymphedema in the abdomen. It's not just in the arm. And it's really from the cancer itself, from the treatment, from the trauma of surgery, from radiation to an area, and it can make people miserable. Fullness, swelling, pain, skin infections. It just can really wreak havoc. And the way we treat it in the conventional medical world is with it's physical therapy, basically. Anybody I know who's going into cancer treatment, I always say, particularly breast cancer, go see somebody who's a lymphedema specialist before you have your surgery. Get in with them so you're a patient of record, because otherwise sometimes it takes months to get in, then if you need it. I went preventively, several visits. I had a little bit of cording on one side, I got right in, did all the exercises, and thank God I've been fine. Kinesiotaping is a new approach that people are using for lymphedema that seems very promising. You've probably seen kinesiotaping on athletes. It basically pulls the muscle away. And there is, right now, there is some, the whole non-invasive, complete decongestive therapy that physical therapists do, it's time intensive, and you got to go and you got to do the exercises, and you got to be on top of it. And also the worst news is that it can happen at any time, even like months and years after. So you just always stay alert, and that's why exercise it helps prevent it for many people. Okay, yoga. There's great research on yoga and lymphedema. It has to be somebody, you should be going to somebody who or a class so the person understands what your limitations might be, of course. You might have to modify postures. Resistance training, weightlifting or TheraBands used to be thought to be bad for it, like it would increase it. But the more they study it, the more they realize when the muscles are stronger, they're better at pushing the lymph where it needs to go. And so that is important to remember. There's also some good research about diaphragmatic breathing as a treatment for lymphedema, really deep, deep breathing where you are using all of the muscles in the chest, and that's for all forms of lymphedema. It's good. Anti-inflammatory diet, modifying salt intake, should probably be under a teaspoon of salt total in a day, which is super easy to measure if you only eat at home. If you eat out, all bets are off because you're probably getting that in one meal. It doesn't matter what you're eating, unless you're having a bowl of plain oatmeal or something, which is terrible without any salt. But B vitamins and folate, you just want to be sure that you're getting the minimum amount of B vitamins. They really help with getting rid of extra fluid. And then bioflavonoids. Bioflavonoids are like a supplement you would take. Bioflavonoids in nature, like if you have an orange, inside the orange is vitamin C. In that white part in the rind, that's where you find the bioflavonoids. Bioflavonoids stabilize the cell wall, cell walls are only in plants. They stabilize the vessels, like the integrity of the vessels, so that less fluid extravasates out of the vessels. That's why bioflavonoids are helpful for lymphedema. And there are different kinds of bioflavonoids. The name you would see, like at the health food source, quercetin with a Q, Quercetin, quercetin is one of them. We use them a lot in the seasonal allergy patients because it also stabilizes the mast cell membranes. The mast cells are the ones that release histamine that make people drippy, sneezy, and all of that. So we love using bioflavonoids with people with lymphedema. And then the one mineral that has shown good efficacy with lymphedema is selenium. You've probably heard of selenium. It's an antioxidant, but it's also good for lymphedema. Some of the botanicals that are effective to some degree or another with lymphedema are astragalus. Maybe some of you take that now during cold and flu season. Astragalus has been shown to be helpful for lymphedema. And the herb derived from peony, those beautiful flowers, can be very helpful with lymphedema. Acupuncture, yes. Low-level laser therapy is being used now, but it's a little bit hard to find somebody who knows how to do it. So I have not had people do it. Aerobics in water, that's probably my favorite thing to send people to, even just walking in water. It pushes the fluids back into the vessels. It's also good for pregnant ladies with the big legs where they're getting too swollen. Pushes the fluids back in. Hydrotherapy in general can be very effective. My favorite hydrotherapy treatments, I was giving another lecture this week at the Hadley Library about prevention and treatment of winter illnesses. And I brought all my supplies with me and I showed people how to do alternating hot and cold foot baths. So like if people have foot or leg lymphedema or hand lymphedema, you can do 2 or 3 minutes hot, 5 seconds ice cold. 2 or 3 minutes hot, 5 seconds ice cold. It gets your hands or your feet, wherever you're doing it for, kind of acting like a second pump, and it just moves. It gets your heart going a little more, and it's free, and there's no side effects. That's my favorite kind of treatments. So I also will send people, if I have people with difficult to budge cases of lymphedema, I will send people to osteopath who works in the cranial field, sort of craniosacral, that kind of people who are trained at moving fluid. It's subtle work. It can be very, very nice. I would say that sauna is contraindicated. That this is one thing people with lymphedema should not do is sauna. Infrared or warm, hot sauna, it's going to make the lymphedema worse. All right.
And hot tubs as well?
Hot tubs are okay as long as they know who's been in them and they're clean. because one of the things that happens with lymphedema is the skin often breaks, so you just don't want to get an infection. And then long heat is not great. So, short bursts in the hot tub can be okay, but not lounging for an hour. That's going to generally make things a little too dilated. And and go from the hot tub for a nice cold rinse. Or if people can't do a cold rinse because it's too shocking, you can take a washcloth, cold, wring it, and just a cold rub has the same effect. All right, peripheral neuropathy, which can really make people miserable, from a lot of the platinum drugs, the taxanes, of course, prevention, like we talked about already. And, it can manifest in so many ways: numbness, tingling, pain, problems with balance. It can really affect people differently, and it can affect fine motor, really can affect quality of life. So in the conventional medical world, they discontinue chemo or shorten it or give less if they find this is happening. But then they're not getting the benefit of the thing that you need, so it's complicated. Antidepressants, anti-seizure meds, pain meds. Yeah.
Someone before maybe what about infrared for cancer treatment or prevention in general?
Infrared sauna. Infrared sauna. Yeah, infrared sauna. There's a lot of people who sell the equipment who will tell you that it's anti-cancer, but the research is not very impressive. I hate to say it. I'm sorry. I do keep a finger on a pulse of this research. The people who sell the equipment will tell you it does everything, but there have been studies and they're not that impressive. So if you like it and it's pleasant for you, and you don't have lymphedema, by all means, enjoy it. But in terms of it being an anti-cancer thing, I'm not that impressed. I'd rather have somebody spend money on a personal trainer or a gym membership or something like that. That's the research is so clear.
I think there's some connection though with heat therapies and lymphomas, and I don't know if it's specifically with lymphomas or blood cancers.
Okay. Well, heat therapy, yeah, I probably had more. Oh, yes, the question, what about heat therapies and particularly lymphoma? I'm probably the person in this room or on this Zoom who's had the most hyperthermia of anybody. I spent 6 weeks in Vienna and did a lot of hyperthermia, local regional hyperthermia around the area of the ovarian cancer, full body hyperthermia, as well as fever therapy, 2 different kinds of fever therapy. So there is a role for heat therapy in the prevention and treatment of cancers alongside conventional care. I would never do them, alone. We know that cancer does not like fever, but you can't get to fever range with any kind of sauna. You can't get there. Fever range is 103.8. You can't get there. If you sit in it all day long, you'll get up maybe 100, maybe 101, but you're not getting to fever range. So I just don't want people to think that if they build or get a sauna, it's beautiful, it's fun, it's nice, it's good overall, but the research on it actually preventing or treating cancer doesn't exist. Hyperthermia, I've done whole lectures on the role and the kinds of hyperthermia that are out there. They're done by machines and setups that are not available in most places, but you can go. There are places that do offer them. There are some naturopathic doctors out in Vancouver. I've had care there as well. It's not that fun. It's not that fun sitting in that unit all day long and having a fever. Oof. It's not that fun. And I'm happy to talk more about that if we have time. Okay, so peripheral neuropathy, basically for me, I'm going to go again with the anti-inflammatory diet, definitely acupuncture. There are some wonderful acupuncturists in our area. We just have so many talented people. Exercise is very important, particularly around balance and strength, and may also help with the altered sensations, period. Physical therapy for some people is very helpful. For other people, it doesn't seem to get the right person. Topical agents, the menthol can be somewhat helpful. The main nutritional supplements that we use for peripheral neuropathy are these. There's a few of them. Fish oil, which I would say that's another one of along with the curcumin, turmeric, like most people should be on fish oil. Unless it's contraindicated for some reason, you're allergic to fish or something. It just has such good research on treatment of so many things. Vitamin D, you want to make sure your vitamin D levels are around, for cancer survivors, I like to see them around 50 to 60. You should ask your primary care doctor to check it every year. It's hard to keep it that high. In the Northeast, you need to have 40% of your body in direct sunlight for 20 minutes or something. Don't quote me on that. Something like that. Most of us don't do that because we're terrified of getting skin cancer beyond anything else. But, that's one problem. But we're not getting enough through the sun. So many people, and the normal range, would be like 25 to 70 or 60, something like that. But you don't want it at 30. That's not high enough for cancer. So, and if you have osteopenia or osteoporosis on top of being a cancer survivor, you really want your vitamin D's higher. And so just get that checked every year, and then you can, take a supplement to make up the difference. Acetyl L-carnitine is something that we use with peripheral neuropathy, as well as vitamin E and alpha-lipoic acid. And they all work by improving the circulation to the extremities and by helping vasodilate the vessels. That's how they work in part. Yes?
Before, during, and after?
The question is, when do you take these things? Before, during, and after? We never take them before because we didn't know that we were even going to be having cancer, so we probably weren't taking it.
It was starting to happen during my treatments, and then.
Okay, so we don't like to use any of those things during treatment, except the fish oil. Except the fish oil. Most oncologists now, like what I have my patients do is bring them, here's the stack of articles from PubMed that talk about fish oil and the prevention of peripheral neuropathy. And hopefully they read a few of those and they're like, okay, it sounds like it's not going to hurt you. A lot of the antioxidants, the fear is that it's going to interfere with the efficacy. That's okay. But if we can get people walking and massaging and some reflexology and the fish oil and the anti-inflammatory diet, and then if they still get it, then we can bring these things in within a couple of... Yeah. Now remember, chemo has a little bit of a long arm. I don't usually start these kind of supplements for at least a month or 6 weeks after somebody stops chemo, because it's still having its effect, and I don't want to interfere with this. Somebody went to the trouble of doing all that harsh stuff. We want it to work, but then we pick up the thread of that. Back to the curcumin, for an herb that we think about with peripheral neuropathy, and also the cannabinoids. It's not part of my license to prescribe them, but they are like, you can get them anywhere, every other corner. Seems like you can get them. I can't tell you which kind, but I can tell you that there's some good research on cannabinoids and peripheral neuropathy. So there is some evidence around stress management, breathing techniques, stress management, mindfulness meditation, positive imagery, sort of reducing the severity and the response to it. So those are the things that I love because they're basically free and there's no side effects, and they're good for a lot of things. So might as well.
Any other suggestions for during treatment?
During treatment, yeah.
Because there was very little preventative for me.
Yeah. During treatment, anything else people can do during treatment. The biggest thing is using the cold mittens and the cold booties if people can. Yeah, and a lot of people didn't do it because nobody told them about it. And I think that's changing, hopefully, in our lifetime. I had a new patient this week who out in the Midwest who I was treating by telehealth, and she sent me the report from the hospital, and they said, and we're going to set you up, if you want, you can do the cold cap so you don't lose your hair, and if you want, you can do the cold booties and the cold. And she said to me, I'm going to do the booties and the hands because that sounds bad and it can last after treatment. I can't also have something cold on my head. I'm going to be like a frigid person. I'll just lose my hair,
Yeah.
The hair comes back. Exactly.
I was frustrated during because there was like nothing.
I know. I'm sorry. I wish that somebody had told you that. I know. I've lost my hair now 3 times. So I have to say this hair is my own, and you will never have a bad hair day once you've lost your hair. Literally. I'm just like so happy to have hair. It can look like anything, And the curls are courtesy of my stem cell donor. I have perfectly straight hair. And this is 2 years out. I haven't had chemo in 2 years.
Mine was
Yeah, but we'll see how long it lasts. It's cute. It's cute. If anybody's ever seen my husband, he's got a big head. He's got the Jew fro, we call it. Sorry to look like my husband, Ah. All right, lack of satisfaction with intimacy and sex, and lack of interest. I think that's for a lot of people. It's just you have like the to-do list, and that's the one that just seems to keep going further. And I didn't even know there was such a bottom to that list. Part of that's normal. You got bigger fish to fry. You're worried about your mortality. You're worried about who's going to take care of this. How am I going to pay for that? You might also be postmenopausal anyway. Maybe you never liked having sex with that person in the first place. I mean, there's lots of unpack here. But suffice it to say that It's also true that many treatments for cancer have an impact on libido just by themselves. You took away all the co-founders. That's part of what they do. And then for men, there are a lot of things, particularly if they have prostate cancer. Now they're on, androgen suppression, and now they have the prostate removed. I mean, like, there's not going to be the capacity to have an erection. It's really, really problematic. And it's improving the conversation around this. And I believe that's because younger and younger people are getting cancer, and they're 35 years old, and they're not going to go a whole life without having any sex. For some people in their 60s or 70s, many of them still have a very nice, lovely, active sex life. A lot of them don't, so they don't bring it up. And I think the doctors and the patients themselves, everybody feels awkward about it. It's awkward. We're trying to save my life, and now you also want to be able to have an orgasm? Like, come on, Well, yeah, I do. So, there it is. And so it's a big problem. And I think most of the issues there's a lot of them are chemical and hormonal. Some of them are just, does the apparatus work? Or I had surgery, or it's pain, there's lymphedema. I mean, there's so many factors. So like anything related to sex, it has a lot to do with the conversation and talking, and that's hard for people and awkward. And then there's also people who are on their own and just, like to have sex with themselves, and like that also is gone, and that they miss that. So I always ask about it. I mean, if it seems relevant, I don't ask about it. Like when somebody's in the middle of treatment, it really is not the first thing on their mind. Oh, it is though for younger people who are like, am I going to lose my sex drive? And then we have to have that conversation. So, yes.
It's interesting because I have now been in and out of cancer treatment since 2019. Also lost my hair multiple times. I've gone through all the stuff. I've never ever once had anyone talk to me about nutrition, exercise, or any of those things, but sexual health I have. And I had an amazing doctor out at MGH in Boston, and it was after a stem cell transplant. And she invited me into a pilot because they had done a research study, and basically half people who went through treatment reported some level of sexual dysfunction, in quotations, which includes disinterest, or lack of interest. And it was wonderful. I did it, and they set you up with multiple sessions with a social worker and recommendations for like estrogen creams and other stuff. But it was men and women, and it was just like, bravo, finally something.
Amazing. I don't know if people could hear that on the Zoom. Okay.
They set you up with multiple partners.
That would have been an interesting
We just had a very wonderful thing that somebody's saying several times in and out through cancer, not had anybody talk about nutrition or exercise, but they did get her involved with a pilot around sexual function and desire and all that, and set up with several partners. That's not what they meant. Several opportunities to fix things. I will say that estrogen replacement therapy is really important, but for a lot of people, they can't take it because they had estrogen receptor positive cancers, so that's out. Some people, things will come back to normal. Some people, they never will. But also, this is true. Like, I don't know if anybody saw the New York Times article this week about youth being put on antidepressants. And it's like a third of teenagers are taking an antidepressant. And for many of them, it totally impacts their libido. They're just burgeoning libido. And for some of them, if they go off the drug, that doesn't change. So they have a whole life of like not feeling. And so if you think about that, and cancer, and a lot of people going through cancer treatment go on some of these drugs. A lot of these drugs don't help with any of this as well. So I don't have any big cures for this, but I will say that communication and conversations and trying to maybe bring back, if you're in a relationship, maybe bringing back some romance. Maybe you might not have the spontaneous desire for sex. It might be more a responsive desire, and you might have to tell your partner, I think I'm going to need a little more, fill in the blank. And then also invest in a good vibrator. That's one thing I will say. Don't get the $4.99 one at Walmart. Your gynecologist and your family doctor can write you a prescription for a very good vibrator. You can take yourself over to Gazebo. I don't know if anybody's been there. They have the most knowledgeable people, And it's all walks of life going in there. People, young people, old people, men, women, whatever, gender, God knows what. And they will take them out. They have them in a case. Remember, like, I grew up in New York City. You go to a diner, they have these cases with the desserts are going around and around. They have the vibrators in a case like that, and they're just kind of going around. And they'll take them out and they'll put it appropriately, on your hand, let you feel the different things. And they're like $100, So let your insurance pay for it. You've been paying into that system all these years. Get yourself a good vibrator. And then use it on yourself without anybody around, so you figure out how it works, And then you can integrate it maybe with a little play. And then for a lot of people, they're never going to want to have intercourse again. They're going to have to find other things to do. Intercourse is not going to be an option. It's not going to work for them anymore. Hopefully their partner's going to understand that. And don't forget about pelvic floor therapy. There's a lot that can be done to help with that. But anybody who's been radiated in that area, the tissue's really permanently changed. I have not had that, thank God. But there's a lot to talk about. Disappointment. It's a loss. It is a loss. Like there's a lot of loss related to cancer, and that's another loss. And I really honor that. And if we can bring it back even a little is nice. And pain, can be a very strong disincentive. So if something hurts, people aren't going to want to do it. So I got to do things in a way. And so with lubrication, I don't know if are there any men on the call on the Zoom?
Don't think so.
Okay, so we're all gals here, I think. Maybe started out something else, but we currently seem to be gals. And what I would say is that there's the idea of lubrication during intimacy, where you use water-based lube, on you and on them. It has to be everybody. But then there's also moisturizing, which is a whole other department. So moisturizing, and I really just like coconut oil. Literally, I have in my house some coconut oil in the kitchen, and I got some coconut oil in the bathroom, and we keep them separate. And I use that one in the bathroom, after not every single time after I urinate, but, a couple times a day, I will moisturize the area. Because it's just like we use the moisturizer everywhere else, that area needs it as well. And the topical estrogens, even for people that have had breast cancer, the research has gone back and forth on topical estrogens in women that have had estrogen receptor positive breast cancer. So that's one I don't have a definitive answer for you. What the research now says is that long-term survival, I'm going to try to get this right because I just read it a couple days ago. Long-term survival is not different, but people who used topical estrogen who had estrogen receptor positive breast cancer had more of a chance of a recurrence. It didn't necessarily kill them, but when I read studies of that, I'm like, but who wants to go through that all again? I mean, it just didn't kill you. It's like, you know what I mean? So in other words, the long-term survival was the same, but they tended to, and it wasn't like by a lot, but it did show some impact there. So I'm like, no, thank you. I'm not signing up for that. Not signing up for that right now. All right. Body aches and pains. Many had before cancer diagnoses. Some are worsened with, a side effect of chemo and radiation and/or radiation, medicines, especially hormone suppression. There's a whole syndrome like estrogen suppression body ache syndrome. It's got some acronym I'm not remembering. And for a lot of people who come to me, they'll be like, I can't take the tamoxifen. I'm not doing the AI. I can't do it. I feel like crap. I'm so sore. My jaw is sore. My arms. I can't work out. I'm not taking it. I'm thinking to myself, this is such a good drug for them. The studies are so strong. It's like I have to do something so they can stay on their tamoxifen. It's really like that. And for most people, they can tolerate it better. Like cherry juice is probably the number one thing that's been studied. Cherry juice concentrate, either in a powder form or a tincture form. Or you could eat an entire bucket of cherries, but you would really make yourself sick. You need quite a lot of it. It's because of the different, forgetting the word, not anthocyanins. There's a thing in cherries that is very anti-inflammatory. So it's like taking an ibuprofen, but a lot of ibuprofen that you can't take because it hurts your liver. A lot of athletes are using it, 100%. I have a son who's a coach in the NBA, and they're all about the cherry juice. Yeah.
Okay. What was recommended to me, and
Yes.
been really helpful, is my diagnosis was 2 years ago, and about a year and a half ago, I started tamoxifen.
Yep.
That was the one that was suggested. But I do it gradually.
Yeah.
So I started off with half of the doses.
Yeah.
And so I'm just slowly bringing it up, and I let my body get used
Adjusting.
to it. So when I
Yeah.
go up a little, I'm not at what they want me yet, but as my primary said, you're you're getting enough,
Yeah.
and it's my quality of life. So
Yeah.
that's made a real
Yeah.
difference. And I think there was a study.
Yeah, there's been several, so the
with
comment here about,
cancerous.
uh-huh,
That's who it was. And
uh-huh.
they didn't have any side effects. So I
Okay.
just go, so I'm just going
go real slow. Comment about starting tamoxifen and just, instead of starting at the full dose, working yourself up slowly under the guidance of somebody who knows what they're doing.
We're working together.
Yeah.
And so, but
Great.
the other things you mentioned too, I mean, acupuncture has really helped me in exercise. So
Yeah.
I don't want to say it's just one.
Right.
I would
Right.
have never thought about that.
Yeah. That's great.
Just suggested it. Yeah.
That's great. Okay. Yeah. I mean, the other thing I would say to people is massage and other hands-on things can be very helpful if you like it. And come to the Cancer Connection periodically and get yourself a massage. I do.
Massage schools. My husband just
Yes.
went there.
Had the massage school. I probably had 20 massages there over the years, and I think I had one dud.
Yeah. Well,
They're mostly good.
yeah.
I had a massage today from a massage therapist in Amherst whose work I just really admire. Anti-inflammatory diet. Alcohol is going to be very inflaming. Remember the thing about alcohol, it's not just the alcohol itself, but when you drink alcohol, it enlarges in your small intestine the area through which your little bits of carbohydrates, fats, and proteins pass. Bigger chunks get through. So if you're like a little bit sensitive to something and bigger chunks get through, you're going to be more sensitive to it. It's going to affect your joints. So like I have a guy in my practice, not a cancer patient, but I'm treating him for something totally unrelated, but he always likes to say to me, look, I love Dr. Amy, I really miss my pizza and beer. I'm like, I'm so sorry. He can have a beer and he's totally fine. And he can have a pizza and he's totally fine, but he cannot have his beer and pizza. Because I think he's like a little sensitive to gluten and a little sensitive to dairy. And then he eats the pizza with the beer and everything, not good. The botanical medicines that we use for inflammation in general include the curcumin, the resveratrol again, and then there's a third one which is beautiful in this setting. It's boswellia. You might have heard that. It's like Indian frankincense. Boswellia, Boswellia. And then fish oil, again, vitamin D, adequate vitamin D levels. And then some people have good success with chondroitin and glucosamine and chondroitin. Those are things that help with the building blocks of cartilage. Bone broth probably works just as well as that, or collagen powder. So a lot of people's bony joint stuff is because they're the soft tissue things, the bursa, the tendons, the softer things, not the actual knuckles and bones, are not as rich and nourished and softening as they once were because of cancer, because of aging, because of treatments. And so taking collagen, like collagen powder, collagen is made up of 3 amino acids that are built in like a chain. And we use collagen a lot for bone health because it helps the calcium and the protein build healthy bone. It's also good for hair and nails and teeth. Everything that arose, like, when we are just conceived, we're like one little cell, and then we're like a line of cells, and then the line bends over, and then it pinches off over here, and that becomes your head, and this part becomes your spine. And in the embryological development, there's one whole part called the ectoderm. And everything that arises from the ectoderm, the skin, the hair, the teeth, the nails, responds to collagen. So I'm a big fan of collagen. You don't need to do it every day. You can do it 2 or 3 times a week, a scoop of collagen. If you're vegan, that's not going to work for you because those are animal products. But there are some vegan collagens, mostly made from krill, like algae, little things in the ocean. And people have shared, I'm not a coffee drinker, people have shared that it goes very nice in coffee. It doesn't change the taste or the texture. So if you're morning coffee, you can put a little scoop of collagen in there. That can help with the body aches and pains. Ensuring adequate vitamin D, I think I said that. Okay. Digestive issues, let's see, we've got 15 minutes.
I have a couple of questions.
Okay, yeah.
afterwards.
Okay, good. Give me your questions.
Give me questions after.
Yeah.
The first one is, can you explain the best way to deal with being unable to hold your urine or your bowel?
Oh, okay. Well, if you can't hold your urine or your bowel movements, there's a lot of reasons for that. If you had radiation in that area, that kind of compromises everything. If you have a kind of ulcerative colitis or graft-versus-host disease that involves your colon, that can lead to looser stools. The best way to strengthen that area is to go to pelvic floor therapy. even if it's digestive or urinary, pelvic floor therapy will help in terms of getting the circulation to the area. They may use very tiny or larger internal probes to teach you how to squeeze muscles that you didn't even remember that you had. There's a lot of biofeedback. The field has really gotten better. And there's some incredible people at Cooley Dick that do this work. So I would suggest that. I think collagen in general can help with the squeezing effect of some of these organs that have spasms and squeezing as part of the normal. Spasms is a little bit of a strong word, but the sphincter is supposed to close off entirely. If that sphincter gets kind of loose, collagen can help strengthen the sphincter. I would say exercise in general. Of course, it's hard to exercise if you're worried that you're going to have an accident. I appreciate that. So you have to wear a pad, whatever, stay close to home. But exercise in general improves circulation. Somebody who's losing stool, we really have to think about, is that because the stool is loose and then we need to address digestive issues, or is it strictly something related to the sphincter? And sometimes there are Botox treatments in that area that have been used as well. So it's probably something that you need some individualized care. It's not like a general statement, but those are some ideas.
And the last one is, can you talk about any particular effects of immunotherapy, the same or different from?
Oh, immunotherapy is really interesting. I've had it myself. I had blinatumomab last 2 years ago in the lead up to my transplant. I was like free of leukemia, and then they found that people that took some immunotherapy, it kind of locked that status in before they give you the transplant. So I had 2 rounds of blinatumomab I think at that time I had a PICC line, and I went in 24/7 for 28 days. I had 10 days off during which my daughter got married, and then I had another 28 days of that. And I couldn't tell I was on it because, most of the immunotherapies, they are tumor load dependent. So the more tumor load you have, the more symptoms you're going to have. So because I didn't have any tumor load, I had no symptoms. So that was nice. Side effect wise, the side effects are pretty general, and they're similar to the side effects people get with chemo. And in terms of the long-term effects, it's not as much of a long-term effect because it's really retraining your own immune system. But sometimes people do develop sort of graft versus host, where your immune system gets too jacked up and too enthusiastic, and then it can fight you, and you can develop autoimmune kind of challenges. So, and treatment is very individualized to the patient in that case. It's not a general thing I could just say. All right, we have 15 minutes, and I want to leave like 10 minutes for Q&A. So I got 5 minutes, so let's take a vote. We can talk about digestive issues, we can talk about insomnia, we can talk about anxiety and depression. Actually, I think what I want to talk about is, because a lot of this we've covered here and there, I would like to talk about how to shift your internal environment to be less hospitable to further cancer. Because that's, we all need that. We all need that. Some of these things are, we have to understand that there's a whole kind of macro environment in our body, and then there's a micro environment in the tumor, around cancer cells. And so everything you do affects everything you do. So that's why I sound like a broken record. Working on the microbiome. So doing things that help improve and make your microbiome more robust and more diverse. Eating cultured and fermented foods every day, a little bit. You just need a forkful, a spoon, a sip. You don't need a big bowl. That's everything from kombucha to kimchi to kefir, yogurt, miso soup, sauerkraut, pickled veggies. You just need, I had a salad for lunch. I put some pickled beets on there. That's my fermented.
You mean actual fermented ones, not just.
I mean actually fermented. So the way you'll know the difference between the fermented ones and the pickled ones is the fermented ones will be twice the price. pretty much,
I just don't like the taste, unfortunately.
Try different ones. And if you don't like the pickled veggies, then you lean into the miso soup, or you get try some kimchi. But if you didn't like the pickled veggies, you're probably not going to like kimchi. I'll buy a bottle of kombucha. It has sugar in it, but it's mostly eaten by the bugs, and that'll last me a couple of weeks. You'll oftentimes buy a bottle of kombucha and they drink it like a soda. You don't need that much, just a couple sips, like that. And then don't do the things that wreck your microbiome. So like alcohol, eating foods that you're allergic to, lots and lots of sugar, processed foods with a lot of hydrogenated fats, not good for the microbiome. Okay, so we don't have to talk about that anymore. Don't smoke, obviously. Try not to be sedentary. Try to find some purpose in your life. I know it's not good. This is a minor little thing. I think people that have a little sense of purpose and connection, I mean, the role of community, family, whatever, we need to be connected, unless we're super, super introverted, I guess. Okay. Then the anti-inflammatory diet we already talked about. And then adequate hydration. You should be thinking about like however much you weigh, half of that amount in ounces of water. So I should be getting 60 ounces of water, 70 ounces of water a day, something like 65 ounces of water a day. I, by nature, would probably get 5 ounces of water a day. I'm basically thirstless. This is my hardest event. I have to force myself to drink. I'm just never thirsty. I did a triathlon a couple months ago. I didn't drink the whole time. I'm just not thirsty. And I don't seem to be suffering too much. I'm going to have a sip of water while I'm saying that. Okay.
And I think that can max out at 6 glasses. You don't want to.
You can max out, right? Like even if you are way more and might need more, don't go more than 6 or 8 big glasses.
Exercising or drinking, it's usually another 4 ounces.
Okay, if you're exercising, you might need a little more. But you don't want to overhydrate because then you'll mess up your electrolytes, which is not good. All right, so the main supplements I think about for people that want to do supplements, it's not for everybody. Don't feel like you have to do supplements to not get cancer. But if you want to do them, the ones I would say, vitamin D, until your levels are stable at the 50 to 60 range. I would say zinc in general with a little bit of copper. So if you take too much zinc, it'll drive down your copper levels, and that's not good for your blood. So you can do 15 milligrams of zinc a day with 1 or 2 milligrams of copper. This would be in a multi, if you're taking a multi. I would say the fish oil would be key. I would say that you want to use mushrooms in any form, certainly food. You eat them, any kind. You don't have to get the expensive lion mane. You can just get the little white button mushrooms. And the thing about mushrooms, don't eat them raw. You can eat them raw, but if you eat them raw, you're not going to get the medicinal, as much of the medicinal, because you can't get through the chitin. Chitin is the cell wall membrane around most plants, and our enzymes don't go through that. So you just...
Coffee, too, that's a big thing.
Oh, yeah, the mushroom coffees. Yeah, I was giving this talk the other day, and it was being videotaped by the Hadley Media. You can find it on YouTube if you want, on how to not get sick, or if you get, not with cancer, just like winter illnesses and treatments for that. And halfway through the talk, I was talking about mushrooms, and the video guy was like, oh, do you mean like that mushroom coffee stuff? I'm like, yes, that's exactly what I mean. Yeah, that's really good. Any form, and just put them in your soups, throw them in a stew, put them in your omelet. They're very anti-cancer. The more we study them, the more we understand. Shiitake, maitake, turkey tail, they're all very good. Okay. I said, I think I've talked about exercise enough, talked about diet enough. Curcumin. Okay, EGCG is derived from green tea. That's has some powerful anti-cancer capacity. I think it's worth, you can't really drink enough green tea to get in the therapeutic range. You need like 6 to 8 cups a day. Most people aren't going to feel good if they drink that much. So that's one I would maybe take in a pill form. EGCG, epigallocatechin gallate, I think is the name. Sulforaphane is another supplement you can take. That's a supplement that's derived from your Brassicaceae family.
What was it?
It's called sulforaphane.
Oh.
Sulforaphane. So like, you don't have to take it as a pill, but just remember that anything in that family, broccoli, cauliflower, Brussels sprouts, kale, they're very, very good for us.
Unfortunately, they cause inflammation in a lot of people.
Some people don't tolerate them as well. For the people that don't tolerate them, what I always ask them to try is try a smaller portion and cook it a lot. You don't lose too much of the medicinal
Broccoli
quality
is the one
cooked.
that seems to not be a problem.
Then that's good.
But
That's
all
good.
the others still
Yeah.
are
Okay.
problematic.
All right. And then the vitamin D. Head game is so important. Toxins in the environment, we talked about that a bit. All right, let's take some questions. We can be about anything we talked about or anything else. Yes.
Can you say more about alcohol? Because I know the sense I get is that we should probably none of us be having any of it.
Yeah.
And that is where I'm at. And it is one of those things that feels so like everywhere I look and everyone around me is drinking. Is there any amount that is?
In general, so the question is there any amount of alcohol that's okay? It seems unfair. You went through all this stuff. At least you can do is have a drink, you know. I hear you. What I will say is that your body reflects the habitual, not the occasional, in general. If you told me every once a month you're going out for a banana split, I'm like, enjoy it. You know what I mean? That said, I find with patients and with myself, the more refined I am in the way I care for myself, and I take, you know, exquisite care of myself, the less I tolerate a lot of things. Like if I went and had a banana split, I would throw up. I know I would throw up. I can't even, I just wouldn't feel good. I mean, I could have a little bit of, like a little mini goldberry plain. Like that I can do, you know. I love that stuff. My husband's like, you really are pathetic if you love that, you know, like the original, you know, goldberry. I think the thing with alcohol, when they say there's no safe amount, I think that what we're realizing is that alcohol is a poison, and that's why there's no safe amount. If you told me like the holidays are coming and you want to have a thing of eggnog or you want to have one gin and tonic, like that is not going to give you cancer. That did not give you cancer. Yeah. So, you know, but I don't want to say, well, just drink in moderation. Because it used to be for years, people say, well, women could have one drink a day, men could have two, and that's considered moderate. Well, that is not true. That is too much.
Every day is a lot.
Yeah. So part of it is what I said before about, you know, makes us more inflamed. Part of it is that it has a lot of sugar. Part of it is that it's just literally hepatotoxic. So if you take an autopsy, if you look at a person who's got like cirrhosis of the liver, it looks very, very much like somebody who has diabetes. And like the way that the liver goes sideways. Yeah, so I love the question because I think what you're also getting at is like, I have been through so much. I have sacrificed so much. I have lost so much. I have literally lost a chunk of my life. Like, I just want to be like everybody else. I just want to have fun. I just want to like, well, you know. And so I hear that. And I feel like that's why once in a while you should just do whatever you want.
Yeah. How about drinking like the THC CBD drinks in place of alcohol?
Yeah, I think that the CBD drinks in place of alcohol, it sounds terrible to me because it sounds like dirty socks, but that's probably because I've never tried it. I think you know, I think it's better than alcohol. Better than alcohol. And I also think like the mocktail world is improving.
Yeah.
It is true. They are better. There are some better mocktails out there. As a person who doesn't drink at all, I don't drink alcohol or water. So like, I don't really miss any of it. All right, what else? Any other questions from our friends online?
No, but I do have one, like in terms of curcumin, like are there times that it doesn't work with medications or in any cancer treatment?
I wouldn't be doing curcumin during like chemotherapy because it's really, it's such an antioxidant, and most chemotherapies that's not going to work with them. But like if you're going through radiation, I would say like we didn't talk, I could really come and do a whole talk about if you're in treatment, here are the things you could do to enhance efficacy, prevent side effects. We should do that sometime. But yeah, but I would say that the biggest thing people can do if they're going through radiation is to exercise right before they get on the table. We know that if you're better perfused before you get on the table, it has a better effect and you have less side effects. And you protect your underlying organs. Yeah.
I have my radiation here.
Yeah.
I do like to walk.
Yeah.
So I started walking to it.
Yeah.
But I kept hearing I'm going to be so tired, so I figured like once I got off the table, I was going to like keel over. So after my first week, my radiologist said, "Okay, you walked here. I want you to walk home now." And there were just a couple of times I had to call somebody, like I couldn't make it home.
Yeah.
But I think it made a big difference.
Yeah, I think it comment here about making a big difference to walk to it. Yeah, I did that. I had my radiation at Cooley Dick as well, and I walked at Child's Park for like an hour before I get on the table. I was like perspiring, and the gals would always say like, "Are you okay? You nervous?" I was like, "No, I just had a great walk." And one day it was raining real bad, and I couldn't walk, and so my husband and I are ballroom dancers, so we're like in the little hallway there around the radiation there on the bottom floor. We're just doing a little cha-cha, getting ready. And then that thing that I mentioned earlier, quercetin, the bioflavonoid, helps to make any cancer cells that might be around more radiosensitive. So I always give my radiation patients quercetin to take during radiation, things like that. And there are things like that with chemo. this chemo, you can take this thing to help cells be more chemosensitive.
They don't share it. They don't know.
Well, I mean, I shared all of it with my doctors. They were all very curious. I mean, a lot of them were like, "Oh, you're doing so good. Just keep doing whatever you're doing." And they never asked me what I was doing, but they all blurred my book. So like I'm indebted to all of them. They all saved my life. So yeah.
You mentioned something about shortness of breath.
Shortness of breath, I mentioned around one of the manifestations of fatigue for some people can be shortness of breath. And some people have shortness of breath because they had radiation to the chest wall and the lung, maybe the top lobe of the lung is compromised. And the most important thing people can do who have shortness of breath because of something like that is to really figure out, 5-10 minutes a day of really focused deep breathing exercises, keep stretching it. The fish oil really helps. That's the collagen really helps. Then there are things you can do that are supportive to the lungs. Be sure that you sleep in the room with a good vaporizer so that you're getting some nice moist air, not getting dried out.
My experience with exercise that I found, because I started later in life with this particular thing, is the high intensity intervals. I have never had anything I've done in my entire life get my lungs and heart in shape.
High intensity intervals, very good.
You don't have to do a lot.
Yeah.
You could do 10 minutes a couple times a week at the most.
Yeah,
and
that's
you will
good.
be amazed.
Yeah, good. And yoga, the ways we can open our chest wall and our rib cages that allow our lungs to expand. But, when I get once a year, I have a chest, abdomen, pelvic CAT scan with contrast, based on my earlier cancers, which I'm not going to be doing as much anymore because a big study came out about how all of this scanning in an asymptomatic person does not save lives. Again, it's that thing about you might get a recurrence, but it's not going to make you live any longer. So I'm not going to get as many because every time I get it's radiation. Oh, that's not very good for you. But why am I saying that? Oh, so they find that I have damage to my upper right lobe, commensurate with having had radiation in that area, 12, 13 years ago. But I don't have any symptoms of it. Like I did this triathlon, I can run, bike, swim, But it's there. That's okay. These mortal bodies, we're going to take a lot of it to our graves. So God willing, in a long time. Thank you for your attention. Everybody stay healthy. And thank you for joining us online. I hope you got something out of it. I'm sorry you couldn't be here in person. And stay well.